Hello, this is Fran Calhoun, Fulton County's Intergovernmental Affairs Manager. This week under the Gold Dome, mental health has become the top focus of conversation, noting that Georgia ranks 48th in the nation for access to mental health services. Legislators have stepped up on both sides of the aisle to address this critical need. We have currently a dozen bills that have been introduced to reform the state's mental health care system and to expand access to those services throughout the state. The most expansive bill is House Bill 1013, an omnibus bill introduced by House Speaker David Ralston. Now, the Speaker doesn't normally introduce legislation, but he stated he was compelled to act this year because there's no more urgent matter during this session than to reform Georgia's mental health system. House Bill 1013 incorporates the recommendations of a task force that's been meeting for the past 2 years that included mental health, substance abuse, and criminal justice experts. And that provides some insight into the broad nature of this 74-page bill. The bill would require insurance companies to provide coverage parity for mental health services, which would mean for most additional coverage to align more with current physical health care coverages. It would also increase the number of mental health professionals in the state by offering educational loan forgiveness and other incentives. It would provide help to law enforcement and first responders on mental health crisis calls, and also improve data and transparency in the behavioral health sector. Likewise, the other mental health bills would require that insurer treatment of claims concerning mental and substance abuse orders are treated equally with health insurance claims. There's also a bill that would initiate mental health treatment as an alternative to prison and provide mental health treatment options during imprisonment. And there are those that would establish mental health training requirements and de-escalation training for law enforcement officers. Some provide really a multifaceted mental health reform approach to addressing homelessness and reducing it in our cities and towns. And then finally, there is a bill that would allow public safety officers to transport patients who are in crisis to an appropriate behavioral health intervention center. So there's much more that will be discussed in the legislature as they deliberate on this critical need in our state. Also continuing, of course, are budget negotiations. The governor and his state agency heads have all presented their separate budget proposals to the Joint Appropriations Committee. And we know that tough negotiations are underway right now just by the sheer number of House and Senate committee meetings that have been canceled on the day of the meeting. So members are busy working to ensure that the fiscal year 2022 amended budget and the $30 billion fiscal year 2023 budget contain items of importance to their relative constituents. And redistricting is moving forward. We are beginning to see a number of local redistricting bills pass quickly in order to meet the Secretary of State's requests for new election district data by February the 18th. So we expect to see this to continue during the next 2 weeks, and we will bring pertinent updates to you soon. Thank you for allowing me to be here with you today.